Good morning. Today we have another great question and topic to discuss from Real Self. This is an older question, but one that comes up all the time with my patients seeking advice on breast augmentation. The question is, do I need an augmentation or a lift? This is one of the most challenging things in breast surgery. Now, in some women, it's very obvious whether they need an augmentation or a lift, but a lot of women fall into somewhat more of a gray area where it's not entirely clear. In general, when we think about these two procedures, they are done for two different purposes. A breast augmentation is typically performed with an implant or your own fat in some cases. The implant or fat is used to add volume to the breast, in effect increasing the size and filling it out to more of a spherical shape. A lift or a mastopexy is used to reposition the breast tissue and usually the nipple areola complex to its more youthful position. As plastic surgeons, we evaluate many things during the exam, but one of the most important things is the level of the nipple. The nipple areola and breast tissue begin to drop over time due to the effects of age, gravity, weight fluctuations, and pregnancy. We call this process ptosis. We have a scale to measure the amount of ptosis with different grades or levels. Now, ptosis is determined by the relationship between the level of the nipple and the inframammary fold. In normal breast, the nipple and breast tissue are above the level of the fold. In grade 1 or mild ptosis, the nipple is at the level of the fold and the breast tissue begins to fall below the level of the fold. In grade 2 or moderate ptosis, the nipple and the majority of the breast tissue are below the level of the fold. And then in grade 3 or severe ptosis, the nipple is essentially pointing towards the floor and is on the lowest portion of the breast tissue. And then there's a condition called pseudotosis where the nipple stays above the fold but the breast tissue sags below it. So now that you know what ptosis is, we can discuss the treatment. If there's no ptosis, then breast augmentation will be perfect in giving you the increased size and shape that you want. With grade 1 ptosis, we often get enough correction of the nipple by placing an implant. Typically, a shaped implant will give the best result in this situation. But when we progress to the level of grade 2 and 3 ptosis, then a mastopexy or lift becomes essential to restore the normal anatomy and reposition the nipple and breast tissue where it belongs. Now, in some circumstances, a woman might have ptosis that bothers her, but also wants larger, rounder breasts. In these cases, we might need to combine both procedures and perform an augmentation and a lift in order to achieve the result we are looking for. This is a very challenging procedure because of all the variables and moving parts, so it's best to discuss this with your plastic surgeon to see if it's the right solution for you. So that is all the time we have for now. In our future videos, I will try and go over the different types of augmentation and mastopexy that are available to allow you to dive deeper into the options you might encounter when going in for your breast surgery consultation. Just remember, being properly educated and finding a safe surgeon should always be your top guides in leading you down this pathway towards a better you.